Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, many men are unsure what their prostate is, what it does or when to call a doctor if they think they might have a problem. If you have trouble starting to urinate or have to go a lot, especially at night, these could be signals that you have an enlarged prostate. So, to discuss on the topic, we have with us today Dr. Amlanjyoti Sarmah, consultant urologist from Apollo Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken is prostate gland, men and prostate problem. But before that, we would also like to know about urologist. Now, what is urologist? What is the role of urologist? What would you like to tell our viewers?
Yeah, urology is an established branch of medical science that mainly deal with urine problems like kidney stone, kidney tumor, prostate related issues, prostate cancer, bladder cancer and urine infection. All those problems, those suffered by females also, like urine difficulty in controlling urine, and these all testicular cancer, these all included in the urology.
Okay. So these are the things which is included in urology. Yes, and these are the diseases. If anyone sees any problem, they have to go and see a urologist. Doctor, we have taken the topic of prostate gland. Now, there must be some confusions in man that what exactly is this. So, what is prostate gland? What would you like to tell?
Prostate gland is a normal gland basically in case of males. So, it is a size of a almonds, like 2 almonds. So, it's located in the bladder outlet.
Okay.
So, in the urinary passage. So, normally it work in the reproduction. So, it secretes some enzymes, fluid, so that it help in the reproductive system during the age of, after the age of 15 to 16, after the puberty, till the age of 40, it usually help in the secretions that helps in the reproductions. But after the age of 40, it start growing in size and it start giving problems. So that is a prostate gland basically.
Okay. So what are the common diseases that is related to prostate gland in men?
So most common is a benign enlargement of the prostate that usually happen after the age of 50.
Okay.
So before the age of 50, the prostate inflammation like prostatitis and other problems like prostate cancer after the age of 50 or 60. These are the 3 most common cause, symptoms, disease that happens to prostate glands.
Okay. So, if these are the common diseases, now there must be some symptoms also that if a person might come to know that there is some problem related to prostate. So, when is the right time to see a doctor? So, what are those symptoms, doctor? What are those basic symptoms?
See, all the symptoms of any symptoms of prostate gland, it may be a benign enlargement of the prostate, that is enlarged in the size of the prostate, but it is not cancerous.
Okay.
So, or it may be cancer prostate or it may be infections. So, in all type of disease related to prostate gland, usually symptoms are almost similar type of symptoms. So, from the symptoms, it's very difficult to differentiate between what type of disease he is suffering from.
Okay.
So, but first and foremost, these symptoms are mainly frequency in urination, that is the patient has to go repeatedly to washroom, the difficulty in passing urine, he has to give extra pressure while he is passing urine like that. So, there may be burning feeling of incomplete passage of urine. He might feel like that I have to go to washroom once more to complete my evacuation of the urine. So, and it's mainly happens in the night.
Okay.
So, it's a disturb the sleep. He has to wake up repeatedly to go to washroom. So, it is an elderly group of patients that those are mainly 60 years. So, these are suffering from prostate enlargement symptoms.
Okay.
So, sometime even in this type of patient, they may pass blood in urine also. Or in emergency session, they may present with retention of urine. That means they are unable to pass urine at all. So, they will feel pain and they will come to our emergency room with the complaint that I am not able to pass urine anymore.
Okay.
So, these are the most common symptoms. But apart from that, sometime in chronic diseases like in long standing symptoms, if we ignore, if the patient ignores, then it may ultimately lead to kidney failures. So patient may present to us as kidney failure patient also.
Okay, okay. Doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মই জানিব বিচাৰিছো মোৰ এবাৰ যেতিয়া মই আল্ট্ৰাসাউণ্ড কৰিছিলো আল্ট্ৰাসাউণ্ড কৰোঁতে মোৰ ৰাইট কিডনিত এটা 0.6 মানে মই এটা চিষ্ট পাইছো কিন্তু কি কাৰণে হৈছে তাত মোৰ কজ নাই কিন্তু ই মোক হাৰ্ম কৰিব নেকি ভৱিষ্যতে
So what is the age of the patient?
অসমীয়াতে ক'ব পাৰে
আপোনাৰ বয়সটো কিমান?
মোৰ 45
45. So actually kidney cysts are very common after the age of 40. These are degenerative cysts. Basically these are the signs of aging. So most of the time if the cyst is asymptomatic, that is if these are not causing any pain or any problem to the patient, this type of cyst usually not require any type of treatment. So, but only in few cases this type of cyst can be cancerous. But if it is a simple type of cyst, if you have already shown to a urologist, so he has given you a clean sheet like this is a type 1 cyst, a simple cyst, then there is nothing to be worried about. This is a simple cyst, you just keep an eye on your checkup, regular health checkup. So, these small cysts are usually present in more than 50% of male or female population regularly.
All right. Thank you so much for calling. I'm sure the answer which doctor gave must be benefited for you. And doctor, if we were talking about the symptoms, the basic symptoms of prostate gland, when is the right time to see a doctor? So what are the other symptoms which is also related to this problem?
See, sometimes patient may present with back pain.
Back pain.
So back pain is usually in advanced disease because prostate cancers that spread to the bones. The very early stage it's not spread, but in the delayed stage usually it's spread to the spine. So patient may present with back pain. So in some time patient may present with fractures of the long bones. These are pathological fractures. So and in other cases in benign enlargement of prostate, in non-cancerous enlargement of the prostate, patient usually not presented with this type of symptoms. So they usually presented with other symptoms that I have already described you.
Okay. Now, doctor, if we talk about now treatment, if a person comes to you with the problem, so what is the first thing? How is the diagnosis part takes place? What kind of test is being conducted? So what is the matter of all? What factors are being used?
See, we first take a history that we ask about what severity is the symptoms.
And is it only seen in the elderly people or we
No.
are talking about the other age group also?
Usually this prostate related enlargement of the prostate and prostate cancer are usually seen after the age of 55 or
Okay.
50. But infection of the prostate can happen at any age. But these are most commonly seen in those group of patients, those are diabetic or have any other comorbidities, that mean associated diseases like hypertension, or it may not be associated with any other disease. It may be in younger age group also, in adolescent also we have seen prostatitis.
Okay, okay.
There is infection that spread from urine infection, or it may be spread from
So
other
it
part
starts
of
from urine infection
Yes.
and then it leads to prostate problems.
Yeah, that is prostatitis. That is
Prostatitis.
infection of the
Okay.
prostate gland. But it is not cancer or enlargement of the prostate.
Okay,
That is
okay.
a regular problem of infection of prostate gland.
And doctor, if we talk about the treatment part, what is the first thing when a patient comes to you? Take the history, of course.
Yeah. Then we do the physical examination. The general protocol is to do a physical examination, and we can see by examining the patient, we can see how enlarged the prostate.
Okay.
We have a rough idea about the prostate gland enlargement. Then we do few basic tests. The first and foremost the ultrasound to see the size of the prostate and to see is there is any involvement of the kidney, is there is any involvement of the other organs, and we do few blood tests also. Like kidney function test, and one more specific test is a serum PSA. So this test is usually we do to detect whether this enlargement of the prostate is due to benign, that is non-cancerous, or cancerous.
Okay.
This is the first and most important test to differentiate between normal enlargement of the prostate gland that is age related or it may be due to cancer related. With a PSA test we can differentiate between these two type of disease.
And
These
then
are first.
when it is ruled out, then the treatment starts according to the disease.
Yes, according to that.
Okay.
If suppose PSA is very high, in that case we go in the line of prostate cancer, then we need further evaluation to know the exact stage of the disease, then is operability of the disease, or in other medical management we can start whatever is required. Then we need further MRI, bone scan, PET scan, something like that. So in case of prostate cancer. But suppose it is not, usually 20% of the cases is only prostate cancer. 80% cases are only benign enlargement of prostate, that is the age-related enlargement of the prostate gland.
Okay. Now, doctor, does all the prostate problems need surgery, or it is also being cured by medicines if the patient takes?
No. See, this surgery is only required in 30 to 40% of the patients.
Okay.
Those patients in the early stage of the enlargement of the prostate gland, those are not very much symptomatic. We can treat them with lifestyle modification only. Like we advise them to take less water in the night, to take less coffee, tea, because this produces increased urination.
Okay.
And exercise regularly, take healthy diet. So these are the first and foremost advice we usually give to those patients. Those are suffering from mild diseases.
Mild diseases.
Yeah. So, and benign enlargement, it is non-cancerous. So in those other group of disease patients, those suffer from moderate to severe symptoms or moderate to severe enlargement of the prostate gland, we give initially with medications, and then if at all required, then we go for surgery. That is different type of surgery we have. So that is the last and the final option we have.
Okay, doctor, we'll talk on more, but right now we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion. So let's proceed with that. Doctor, coming back to you again. Earlier to the break, we had a basic idea about the symptoms of prostate problems in men. Now, if we were talking about the treatment, you were talking about the treatment if at all surgery is needed or not, or it is being cured by other modes also. So what more you want to add on this?
See, after the medicines, if the patient fails medical management, in those cases we advise them for surgery.
Okay.
So we have different type of surgery. Initially, in bygone days, usually we did open surgery, but nowadays it is obsolete now. So most of the cases we do now laser surgery. That is the most advanced form of prostate surgery for benign enlargement of the prostate.
Okay.
So in this type of laser-related treatment, the complications rates are very low and success rate is very high. And those patients, after being operated with laser surgery, the recurrence rate is very less because this prostate gland tend to grow again after the surgery. So this laser surgery has revolutionized the treatment, that the recurrence rate has gone down to less than 1 to 2%. So after the surgery, they never come back again for the same symptoms.
Okay. Now, doctor, when we talk about treatment, when we talk about any kind of surgery, there is a notion among the people that things will be done better outside, or we should go outside for surgery. But nowadays, what we have seen in hospitals out here in Guwahati as well, things have been advanced, equipments have been advanced. So on that note, what would you like to suggest to tell our viewers who are watching our show?
See, before maybe 15-20 years back, there was not much facilities maybe. So, but nowadays these laser procedures and other procedures for prostate cancer, laparoscopic surgery are being done very regularly nowadays.
Okay.
Every month maybe 50-60 cases. These are very common nowadays.
Okay.
Prostate
every month 50-60 cases.
Yes, yes.
Okay.
For,
so there is a lot number of patients.
Lot number of patients.
Okay, okay.
Yeah, being done with laser surgery for prostate. So and they are very satisfied also, and they never come back again. Mostly, as I have already told you, only 1 or 2% of the cases they came back again after maybe for 5 or 6 years after the surgery with the recurrence of the prostate gland enlargement. but 90 to 95% of the patients, they never come back again for this similar type of symptoms.
Okay.
So,
now, why this recurrence, doctor? Is there anything to do with the patient or the attendant? Like, because there must be some precautionary measures which just has to be taken after the surgery or after the medicines which have been completed. So, is it something to do with the lifestyle? Why these recurrence, or is there a recurrence anytime you will have?
see, recurrence is actually this if you have not done properly the surgery, number one.
Or the course of medicine you have not completed.
And the course of the medicine has not been completed. Halfway you have left the medicines. Then second is if you are genetically predetermined. Suppose, see, these prostate related diseases are mainly genetic, this is familial. So if your that means somebody's father has suffered from the prostate illness, there is high likelihood that his son will also suffer from prostate related problem. It may not be severe, but more or less he is likely. So in those type of patients, they should be more careful. So they should come early checkup, they should come for, there is a facility of screening also. They can come after the age of 50 or 55 for regular yearly or two yearly for annual checkup. And we can exactly determine whether he requires any type of treatment at all, then we can give him. Then dietary is also important. We have seen that those patients take fatty diets.
Fatty diets.
Yeah, that is, and second is alcohol intake. And these are two other factors that increases the risk of prostate cancer.
Okay. Now, doctor, after the treatment, what are the measures and what are the precautionary measures you suggest the patient to be taken at home when they go back?
In the immediate post-operation, we advise them to take rest for few months, and after that we take to advise them to come regularly for health checkup. Then they take, as I have already told you that you should take less water in the night, because his this lifestyle modification is very important. Then he should go for regular activity. Physical exercise, yoga is very good for them, because those patients are mostly elderly patients, maybe more than 60-70 years. So it is very difficult for them to go for physical activity.
Basically to keep themselves engaged in something.
Yeah, fit. And they have to control their blood sugar regularly with medications. Most of the patients nowadays are suffering from same hypertension and increased blood sugar, that is diabetes. So that is interrelated. So we advise them to take medication regularly. And repeated urinary infection can happen in those type of elderly patients. So they should be careful regarding their personal hygiene also.
Personal hygiene also. All right. Now, doctor, does this prostate problem also put a psychological impact on the patient as well? Because like you mentioned, like you should take less water at night because of the frequent intuition of going to washrooms. So that can also put a psychological, because you will not have a proper sleep. And for that, when you wake up in the morning and you are irritated, or maybe it puts a psychological impact on you as well. So on that note, what counseling, do you also counsel the patient, or a counseling team is also there for your in your hospitals to counsel the patient and as well as the attendants as well, how to make their lifestyle easy?
So it is very important, because number one is the psychological impact, means he will feel tired in the morning, and then his sleep is very important. And then the second thing is in elderly patient, they may fall during the night going to the washroom repeatedly. So it has been seen that the number of fracture with coming more in the night, falling within the washroom, going to repeatedly to the washroom, in the washroom. So that is a problem, and we give them the psychological. We give them the assurance that you should not be worried about this. You have to take some medicines for that. Otherwise, it will be difficult to maintain. Sleep is very important in the night. So this is very bothersome for those type of patients. Those are benign enlargement. That is enlargement of the prostate. But in those cancer patients, the psychological impact is also related to their sexual dysfunction also. After the surgery, we have seen that is already been documented that in some group of patients, usually 20-25% of the cases, they usually suffer from sexual dysfunction also. So there is treatment. We can give them medications. It will take some time but they usually recover with now in advanced medications, and with advanced surgeries, we can prevent their sexual functions also.
Okay. So, doctor, is there a risk factor also in this illness? Is there any risk factor that patient has to be worried about?
Yes. As I have already told you, the risk factors are, number one is a genetic. If there is any family history of someone very near one, suppose your mother is a father or your uncle has suffered from this type of disease, cancer mainly, or benign enlargement of the prostate, that you have to be very careful.
So this is a genetic problem as well?
Yeah, it is family, it runs in family.
Okay.
So in those type of, those group of patients should come for regular checkup, early checkup. So they have to be very careful regarding it. Smoking is also a risk factor that has been documented. So if you are a smoker, then you have to stop this.
Okay. Now, doctor, talking about the diet, now which are the food that has to be included in your diet and one has to avoid it immediately after the treatment or before that to have a proper lifestyle? What would you like to suggest?
Yeah, smoking, number one, you have to stop. Alcohol intake and high fatty diet. These are, and red meat is, you have to modify your red meat diet. Okay, you should avoid the red meat, taking high amount of red meat. Then you should take that's citrus fruits, and apart from this, you should also take some antioxidants like green teas, and other form of antioxidants are also very helpful in those type of patients. And even as a preventive measure, these are good antioxidants, and take lots of fruits in your diet. And you should control your diabetes also regularly, because these are all risk related, and proper exercise.
Okay. Now, doctor, you mentioned about that nowadays laser surgery is being conducted on the patient. So how safe is the surgery? Is there anything to worry about the surgery?
We do laser surgery for benign enlargement of the prostate. So it is very safe. So initially there was some risks of bleeding, and but that can be also treated with medication. Now with laser surgery, it has come down to less than 0.1 to 0.2%. And second, risks of infections were there before this laser surgery, but now after introduction of this laser surgery, risks of this infection has also come down to very minimal. Patient usually 1 to 2% of the patient presented with infection post-operatively. But that can also be treated very well with medications.
Okay. And doctor, you also said that these problems or this problem might also lead to urine infection as well. So one has to take extra care about that as well, isn't it?
Yeah. So this prostate gland enlargement causes urine infection. Even though may not be enlargement of the prostate, in those group of patients also may present with infection of the urine and prostate gland node. But this group of patients are usually younger age group.
Okay.
So it may be STD related also, or it may be urinary tract infection also. So in those cases, you have to take plenty of water, and you have to go to washroom regularly. Don't keep I'm telling about the younger age group.
Younger age group.
So you should not hold your urine for a long time. And then if you are suffering from recurrent type of infection, prostatitis, then in those cases you require long-term medication. Then you have to follow the advice that is given by urologist.
All right, doctor, we are really short of time. So what message you would like to give our viewers who are watching our show?
The message is very clear. This enlargement of the prostate and the prostate gland cancer is a very treatable condition. With the advancement of the laser surgery and laparoscopic surgery, it can be treated with very minimal complications and with very minimal morbidity. So there is no point to be worried about. So if you are suffering from any type of symptoms that we have already discussed, you should better go to an urologist and take a proper opinion, so that it can be treated early and you will be cured of this disease. Thank you.
All right. Thank you so much, doctor, for joining to Good Life and giving those wonderful message to the viewers who are watching our show. And viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.